At Coshocton Regional Medical Center, we are a Joint Commission-accredited diagnostic imaging facility and partner with a national radiologist group providing 24/7 coverage. Imaging services include radiography, fluoroscopy, CT, MRI, bone density, mammography, nuclear medicine, ultrasound, and echo sonography diagnostics. A unique aspect of care in a small rural facility, such as ours, is continuum of care across imaging modalities. Many of our technologists are multimodality board certified, meaning the same technologist taking your X-ray may also do your MRI or CT, and will already be familiar with your history. Coshocton Regional Medical Center is an all-digital imaging facility. All images are captured through direct exposure technology, eliminating film or post-processing of detectors. X-ray imaging services are offered 24/7, no appointment needed. Radiography uses a very small dose of ionizing radiation. Data from ionizing radiation is collected when it hits a digital detector after passing through the body. Images are most often used to help diagnose fractured bones. X-rays can also look for injury, infection, or foreign objects. Portable units allow real-time imaging at the bedside, saving time in critical care situations. Processing software highlights confirmation of line placements used for life-saving care and medication administration. Fluoroscopy is a subspecialty of radiography that utilizes a stream or pulsing radiation to produce real-time moving images of structures. Most fluoroscopy exams use a barium or iodine contrast. It's like a movie, except there's no popcorn. Fluoroscopy procedures include modified swallowing studies for speech and diet planning, sniff evaluations, all gastrointestinal imaging, and interventional radiography procedures such as joint injections for pain, arthrography, and myelograms. Computed tomography, or CT, uses radiation to produce detailed imaging presented as slices of anatomy. Some CT slices are as small as 0.5 millimeter, like a loaf of bread compared to a sliced loaf. An X-ray shows the entire loaf of bread, whereas CT is like cutting the loaf of bread into slices. Reconstruction software allows sharper, smoother imaging with less radiation by applying special calculations that remove image noise or graininess. Maximum intensity projections (MIPs) create 3D-like images by compiling the highest intensity pixels from multiple slices onto one image. Post-processing technology allows twisting anatomy to appear in one image, known as a curved reformat. We perform routine, multi-phase, angiography or vascular studies, CT-guided interventional procedures such as lung and liver biopsies, and low-dose lung screening CTs. CT is often the best method for detecting many cancers. Images can show if there is a tumor and determine its precise size and location. Low-dose lung CTs are the gold standard for lung cancer screening. This exam produces images of high enough quality to detect many abnormalities while using up to 90% less ionizing radiation than a conventional chest CT. Lung cancer that is detected early, before spreading to other areas of the body, is more often successfully treated and improves survival rates by 20%. Yet, only 1 in 8 patients who are eligible for low-dose lung CT report having completed one. The U.S. Preventive Services Task Force recommends annual screening for lung cancer with a low-dose lung CT in adults age 50 to 80 who have a 20-pack-year smoking history and currently smoke or have quit within the past 15 years. If you meet screening criteria, cost is covered by Medicare, Medicaid, and most private insurance companies. Coshocton Regional Medical Center is Coshocton County's home to a full in-house MRI suite. boasting an expansive exam room with a full wall of floor-to-ceiling windows, allowing for more natural light. This creates a spacious feeling that can help reduce claustrophobia risk, enabling patients to receive higher-quality traditional MRI imaging compared to lower-resolution images associated with open MRIs. Along with our open-feeling physical environment, our MRI technologists are trained in claustrophobic patient coaching, and we offer patient-centered extended appointment times for patients who need assistance working through fears or physically need breaks between exams. Magnetic resonance imaging, MRI, uses a powerful magnetic field, radio waves, and a computer to produce detailed pictures of the body's internal structures. Similar to how CT produces images like slices, MRI does as well, but does not involve radiation. MR imaging is used to evaluate the body for a variety of conditions, including tumors and diseases of the liver, heart and bowel, tendon, ligament, and nerve detail. Bone density is a type of low-level radiation imaging using dual-energy X-ray absorptiometry. This is why bone density is also known as DEXA and is clinically proven to be an accurate method of measuring bone mineral density, BMD, in the body. For general bone density screenings, the American College of Radiology recommends measurements of the lumbar spine and hips. Bone density screenings are used primarily in the diagnosis and management of osteoporosis and other diseases characterized by abnormal BMD, as well as to monitor response to therapy for these conditions. Density measurements are compared to the average population of patients of a similar age and sex. This calculation is called a T-score. The lower a patient's T-score, the higher the risk of osteoporosis. Who needs a bone density screening? The American College of Radiology recommends bone density screening for all women aged 65 years and older and men aged 70 years and older, or those who have risk factors for osteoporosis. Risk factors include long-term use of corticosteroids, a history of fracture of the wrist, hip, spine, or arm, family history of osteoporotic fracture, current or former tobacco use, hormonal imbalances, low body mass or loss of height, and excessive use of alcohol. Immerse yourself in our 3D Mammography Sensory Suite, designed to ease anxiety associated with mammograms. Surrounding monitors appeal to multi-sensory relaxation, soft curved surfaces, and flex compression paddles, where sensors adjust compression to the contour of anatomy, ensuring sufficient compression across the entire breast for uniform images, while helping to reduce discomfort. Like how CT and MRI images appear as slices, 3D tomosynthesis breast imaging is like slicing a loaf of bread into multiple images, whereas a 2D mammogram is a plain X-ray where the entire loaf of bread is compressed onto one image. Areas of concern that may be obscured on a 2D image by surrounding tissue can clearly be seen on 3D breast imaging. This allows for more accurate diagnosis on initial screening mammograms, reducing the need for further testing or callback rates, while increasing cancer detection at earlier stages. More images doesn't always mean more radiation. Special reconstruction software allows sharper, smoother imaging with less radiation, so 3D images can be obtained as part of our routine mammography screenings without an increase in radiation exposure. Imagine looking at thousands of images a day like this. In the images below, there is a soccer ball and panda in these images that are cancerous masses. Improving early cancer detection rates beyond 3D imaging, computer-aided detection software called iCAD is always included as part of our mammography exam at no extra cost and acts as a second set of eyes, highlighting areas of concern for the doctor. Were you able to find them? iCAD can in less than a second. One in 8 women will develop breast cancer. Early detection is the most important factor to surviving the disease, improving survival rates to 99%. Regular screenings can detect masses at a fraction of the size of palpable lumps, improving prognosis due to better surgical options and more effective chemotherapy treatment. Coshocton Regional Medical Center is accredited by and follows the American College of Radiology's recommendations for mammography screenings. All women should have a risk assessment by age 25 to determine if they should start screenings earlier than the national recommended age. New studies have shown this is especially important for minority women, whose risk is twofold for aggressive tumors. All women age 40 and older should get annual mammograms. Skipping a year between mammograms can result in up to 30% of cancers being missed. There is no definitive age to stop annual screenings unless severe comorbidities limit life expectancy. If you would pursue treatment if diagnosed with breast cancer, you should continue with annual screenings no matter your age. Nuclear medicine provides unique information that often cannot be obtained using other imaging procedures. Exams help diagnose many types of cancers: heart disease, gastrointestinal, endocrine, neurological disorders, and other health conditions. Because nuclear medicine procedures can pinpoint molecular activity within the body, they can detect disease in its earliest stages when it is most easily treated. Nuclear medicine imaging uses small amounts of radioactive materials called radioisotopes, also commonly called radiotracers or radiopharmaceuticals. Radioactive materials emit, or give off, a type of radiation called gamma rays as their radiation breaks down. The material is linked or tagged to a molecule that the area of interest is attracted to. For example, a nuclear medicine study of the thyroid uses a radioisotope that is linked to iodine because the thyroid naturally absorbs iodine in the body. Isotopes are typically injected into the bloodstream, swallowed, or inhaled. Tagged or linked to a target material, the radioisotope travels through the body to the area being examined and gives off energy in the form of gamma rays, which are detected by a special camera. A computer processes the information from the camera to create images of the targeted area. Cardiac nuclear medicine imaging evaluates the heart for coronary artery disease and cardiomyopathy, which is disease of the heart muscle. Images show the distribution of blood flow to the heart muscle and can be used to visualize the function of the heart. To evaluate the heart's coronary arteries, a stress test is when images are taken immediately after patients have engaged in physical exercise. A stress test maximizes blood flow throughout the heart, making any blockages of the coronary arteries easier to detect. These images of the heart are compared with images taken while the patient is at rest. Patients who are unable to exercise are given medication that increases blood flow to the heart. In a modality where technologists play a crucial role in identifying pathology, acting as doctors' first set of eyes on the inside, we go above and beyond approval from Joint Commission, maintaining accreditation from the American College of Radiology in General Ultrasound and the Intersocietal Accreditation Commission in Vascular Ultrasound. Ultrasound imaging uses a transducer or probe to generate sound waves. Different types of tissue absorb or reflect the sound waves back to the transducer, and the strength of the reflected wave forms an image of the body's internal structures. Ultrasound does not use ionizing radiation, has no known harmful effects, and provides a clear picture of soft tissues that don't show up well on X-ray images. Ultrasound is commonly used as a screening method for high-risk vascular disease and is recommended for adults age 50 and older, currently or have a history of smoking, high blood pressure, and diabetes. Carotid Doppler ultrasounds show blocked or narrowed carotid arteries due to coronary artery disease, which can increase the risk of stroke. Abdominal aorta ultrasound measures the diameter of the aorta, detecting aneurysms, known as AAAs, that often have no symptoms until rupture and are often fatal if not caught in time. Ankle brachial index studies compare blood pressure in the upper extremities to the lower extremities to evaluate for peripheral vascular disease, PVD. Ultrasound is often used to help diagnose vascular disease and other conditions related to blood flow, unexplained pain, swelling, infection, diagnostic breast health, and OB ultrasounds, monitoring the growth of an unborn child. Many biopsies, aspirations, and drainage interventional procedures utilize ultrasound imaging guidance to ensure accuracy. While sound waves are active, ultrasound is similar to fluoroscopy, being a live stream of images showing the needle as it advances. It's like a movie, but still no popcorn. Echocardiography is a type of ultrasound specializing in diagnostic cardiac imaging. Echoes can capture real-time images of the heart, viewing blood flow, allowing for evaluation of blockages and calculating how efficient the heart is functioning. Along with chest pain and heart failure accreditations, Coshocton Regional Medical Center is proud to be accredited in echocardiography by the Intersocietal Accreditation Commission, a testament to our commitment of providing compassionate quality care for our community. We offer transthoracic echo, transesophageal, and stress echoes. Sound waves are transmitted through the chest wall for transthoracic and stress echo studies. Stress echoes are a type of transthoracic echo. Images are obtained while the patient is resting and after physical activity, while the heart is under stress. During a transesophageal echo, the throat is numbed and an ultrasound transducer is passed into the esophagus to obtain even more detailed pictures of the heart.